Intimacy and sex with a heart condition. Hello, and welcome to this video guide on intimacy and sex with a heart condition. My name is Matthew, and I'm an assistant psychologist working with the UHBW cardiac rehabilitation team. In this video, we will explore resuming a sexually active life following a cardiac event or diagnosis, including precautions, common issues, and advice. The information presented will include data from research, experiences from other cardiac patients, and ways that you can look after yourself. Overview. This video will cover the following topics: sex and its benefits, sex with different heart conditions, precautions to take, common issues including impotence, and advice to take when resuming sexual activity. If you have any concerns about your heart condition, please speak to your GP, cardiac team, and look at the information on the British Heart Foundation and our Trust websites. Sex and its benefits. For many people, sexual activity is an important part of life, strengthening the connections between partners. This includes people with one partner or those with several. Sex has lots of physical benefits, such as improving your sleep and immune system function. Sex promotes heart health, including reducing the risk of heart disease or a cardiac event. It can also improve mental health, such as by reducing anxiety, improving mood, and lowering stress. This is particularly helpful following a stressful cardiac event or other heart condition, where you are more likely to be experiencing negative emotions. Sex with a heart condition. For people who have had a cardiac event or diagnosis, it can feel scary to return to an active sex life. For example, you may feel worried about sex causing another cardiac event or making your condition worse. It's important to resume sexual activity in your own time, and you should try and be open and honest about this with partners. Sex is not more likely to cause further heart problems than other physical activity, and is about as tiring as climbing 2 flights of stairs or walking a mile on flat ground. Wait for a stage in your recovery where you can do these activities before resuming sex. Sex with different conditions. How quickly you resume sexual activity will depend on you, your health, and your heart condition. In any case, you should avoid sex in the first 2 to 3 weeks after your cardiac event, and check with your cardiac team when you can safely return to sex. If you had a heart attack, most people can have sex within 3 to 6 weeks, but this depends on your own individual health, the size of your heart attack, and whether there are any remaining heart issues, such as chest pain or arrhythmias. If you have had open heart surgery, it's important to give enough time for your sternum to heal before resuming sexual activity. This may take up to 6 to 8 weeks depending on your recovery. When you do return to sex, limit any positions that put pressure on your sternum. If you have had a pacemaker or ICD fitted, avoid positions that place pressure on the arm or chest for at least the first 4 weeks. If you have heart failure, you may experience difficulties with sex due to fatigue, which can be caused by both your condition and your medication. If these issues make sexual activity too difficult, your cardiac team may be able to adjust your treatment. Regardless of your condition, it's really important to voice any issues or concerns with your cardiac team. It can be difficult to bring up the topic of sex up, as many of us consider it to be private and intimate. Remember that sex is an important part of many people's lives, and it is normal to feel uncomfortable when discussing it with others. Your cardiac team will be able to treat your issues respectfully and with discretion, and anything you share with them will be strictly confidential. Finding a new normal. When returning to an active sex life, there are common issues that you may experience. As with other physical activity, you may feel tired more easily than normal, which may make sex more difficult. Certain positions may be less comfortable than they were before, and it may take time to adjust and find what works best. You may feel anxious about resuming sex, particularly at first, and you may be conscious about new limitations. These feelings are normal, and it will take time for you and your partner to emotionally recover from your event or diagnosis, and to find your new normal. Try and communicate about your issues and concerns with your partner, and work through them together. Some people can feel embarrassed about experiencing difficulties with sex, but it's important to remember that difficulties are normal following a heart event, and you should feel proud that you have recovered to a point where you can resume activity. Try and imagine what you would say to a friend going through the same situation. Possible difficulties. Some people may experience new difficulties with sex as a result of a heart event or condition. Some men may experience erectile dysfunction, which is when there is a problem getting or maintaining a strong enough erection for satisfying sex. This issue can be caused by medication, stress, or anxiety, all of which can affect you when you have a heart condition. Some women may experience vaginal dryness, which can cause discomfort, itching, and pain, and prevent you from having satisfying sex. Heart issues can also affect your sex drive and experience. In many cases, erectile dysfunction, dryness, and other sex issues can improve with time, especially after a major health incident. Trying new ways to have sex, such as by using lubricants, can also help. However, if these issues persist, the first step is to always speak up to your GP or pharmacist, who can look at your situation and offer appropriate support. Medications, treatments, or therapy may all be options depending on your situation. Being open with your partner about these issues is also important. They will understand and want to support you and your recovery in the best way. Remember that it's possible to have a satisfying sex life without penetrative sex, as long as you are willing to communicate with your partner and explore options. Sexual issues do not change who you are, and many other people are affected by the same conditions. We will now hear what some of our other patients had to say about their experiences.
My name's Ian Clapp. I'm 70 years old. I run a hotel and a spa. I'm sort of busy, which I felt the stress probably brought on my heart attack. I've had a double whammy because I had prostate cancer and I had to remove my prostate and lymph glands, which was only 3 months before I had my heart attack. So I sort of had a whole procedure. And obviously it's been an adaptation between me and my wife, who we were very close before. Now we're close, but in a different type of closeness, because it's not necessarily sexual. It's the closeness of actually the intimacy of cuddling each other or whatever. It's very difficult to cuddle even in bed or anything. It's very hard because you almost, after the operation, need to be left alone because you're in too much pain for a very long time. While your healing process is quite difficult. And I think this is something that all couples have to have realised. Time is probably the ingredients to it.
My name is Jake Chu. I'm 47 years old. One day I was just walking and that pain came on and it went down my left arm, and I thought, that's not great. I had severe artery blockages that were going to require a triple heart bypass, which was a massive shock. Intimacy isn't the first thing you think of at that time, and it gets pushed to the back of the queue, if you like, because you've got your brain and your mind is so focused on that one thing. But it does come back. And I found after I had the operation and got over the initial kind of physical wound that everything else was okay. And then you start to realise that life's going to be all right, and you've got through the worst of it, and then everything else that you should be enjoying, things like intimacy, come flooding back, and before you know it, all the bad experience you went through is a distant memory, and the rest of your life is there.
When returning to sexual activity, there are several precautions that you can take to make sure that you're ready and that you stay safe. If the idea of suddenly resuming a full sexual life seems scary, you can ease yourself back into physical intimacy with your partner. For example, you may want to start with gentler acts, such as holding hands, cuddling, and kissing. You can then work yourself up to a point that feels comfortable for you and your partner in your own time. Communication with your partner is always essential, so make sure to discuss any worries or issues that you have and work through them together. If you are struggling to work through these issues, you can always access support through relationship or sex therapy. You may also find it helpful to join a support group of people who are going through similar things. We will provide any local support groups available on our Trust websites. Generally, you should try and avoid sexual activity in very hot or cold temperatures, straight after eating a heavy meal, or after drinking alcohol, as these may place extra stress on the heart. Also, while sex has its benefits, it's always important to remember that unprotected sex is risky for your health and your future. Sex without appropriate contraceptives leads to unplanned pregnancies and the risk of spreading sexually transmitted infections. Always ensure your safety when engaging with sexual activity, and make sure to discuss this with your partner in advance. You should immediately stop and seek immediate medical attention if you experience chest pain during sexual activity. Questions for the health team. Here is a list of questions that you can ask your health team if you're experiencing issues or concerns with resuming sexual activity. Make a note of any that may be helpful for you to discuss. Summary. Sexual activity is an important part of romantic relationships and has many physical and emotional benefits. You may feel anxious about returning to sexual activity following a cardiac event or diagnosis, but sex is no more dangerous than other physical activities. Consult your cardiac team on when it will be safe for you and ensure that you allow yourself time and patience to working your activity up to a comfortable level for you and your partner. Sexual issues are common, so make sure you always communicate with your partner and seek support when necessary.